So good evening all. Welcome to the one of the mastermind session and the session from the Ayurpreneur Academy with the sessions of stalwarts. So the Ayurpreneur Academy is hosting such stalwarts talks, speak the webinar, the sessions to help and build the Ayurveda students to develop the competence in their particular profession. So with that intention, the Ayurpreneur Academy has been started, and I welcome all of you for this wonderful session which is going to be happen. And I am happy that my Guruji, my mentor, and my inspiration, Professor Hemant Kumar sir, has accepted my request and invitation, and he is here today to deliver his knowledge and share his knowledge. And this session will be in two parts. One is the first 10 minutes. I will be briefing about the what exactly Ayurpreneur Academy, the platform which is providing you this knowledge, and then followed by Hemant sir's session will be there, which will be around 1 hour, and sir will be specifically focusing on one disease so that you can understand the concept of the Marma Chikitsa. And at the end of the session of the sir, there will be question and answer session, and at the same time, I would like to be honest to express that I'm building a community of Ayurveda people, all the Ayurveda community people. So with the name of Ayurpreneur Lifestyle Hub, and I'll be upselling the subscription for that Ayurpreneur Lifestyle Hub membership, lifetime membership for Ayurpreneur Lifestyle Hub. So I want to be honest at the beginning of the session itself. Of course, it's not a compulsion. If you resonate with the theme and the what you call the idea and the purpose of the community, you can join. And the good thing is that I am offering it at 90% discount so that it can be affordable for everyone. And the ultimate goal is not to make money, rather it is to build a community who can support together and grow together. Okay. So with that, I would like to, before introducing Hemant sir, I would like to brief about the Ayurpreneur Academy, and once after introducing Hemant sir, then session can be started. So let me share my screen so that I can share what exactly with what purpose this particular academy has been started. Okay. So I believe my screen is visible. And Dr. Krishna, kindly confirm me once it is visible. Okay, thank you. So the Ayurpreneur Academy is an Ayurveda School of Entrepreneurship founded on 10th October 2022. That is 10th October is my birthday of my daughter, Miss Vajra. And I founded this particular, what you call the academy. Let me hide this floating controls. Okay. So the Ayurveda School of Entrepreneurship, which is founded on 10th of October 2022 with the, what you call, the logo was launched by one of my mentor, my Guruji, Dr. Prasanna Rao, and Hemant Oshikane sir and Professor B.J. Kulkarni sir on the 8th of December 2022 at Panjim, Goa, when the World Ayurveda Congress 2022 was happening. Okay. So what made me to think about this academy is, see, all of you, I don't know how many of you are aware of this one. There is a problem statement with the Ayurveda stakeholders, or rather Ayurveda doctors, Ayurveda graduates. Even though Ayurveda global market is about 13 billion US dollar at the end of 2022, and is expected to reach the 16,000 to 30 million US dollar at the rate of cumulative annual growth rate of 23%. But whether really our Ayurveda doctors or Ayurveda professionals, they are making money out of Ayurveda? How many of you think? You can put your opinions in the chat box. Okay, chat box is enabled. You can put your, how many of you agree that the whatever this big size you are seeing, okay, and the growth, which is almost by 2032, the growth of the global Ayurvedic market size will be 26.16 billion US dollar. But unfortunately, most of the Ayurveda doctors, rather 95% of the Ayurveda doctors, they are not directly getting any benefit of this. The global market, they are not making use of that opportunity. So this has made me to feel that why we are with this such a huge global market of Ayurveda, why our Ayurveda students, our Ayurveda faculties who are going for the cross practice and who are living with a mediocre lifestyle. Okay, and because of that, I felt that it has become a purpose to elevate the self-confidence, self-respect, and professional significance of all my fellow Ayurveda friends. So it was burning in my mind, and it was always, I used to feel pain at the heart looking at this size and the and even then, why our people are living an average life. So me and my wife, the co-founder of this Ayurpreneur, Dr. Krishna Thorkuroli, we came up with this concept of Ayurpreneur Academy, and this with a vision of to collectively empower all the Ayurveda professionals to develop an entrepreneurial mindset and skills to lead an abundant lifestyle by adding value to the society in the healthcare sector. Okay, why I'm speaking about entrepreneurship? Entrepreneurship is the only area which can give you exponential growth rather than the conventional what we are doing till date. Okay, so the mission of this Ayurpreneur Academy is to create a vibrant Ayurpreneur lifestyle hub community of 100,000 Ayurveda professionals to achieve and live an entrepreneurial lifestyle using their Ayurveda knowledge and skill to accomplish social and professional significance, financial abundance, and time freedom using our Ayurveda business model, Ayurveda business mastery, and Ayurveda business empire. The three systems I have created so that will give an idea, the guidance, and it will be like a career guidance as well as the hand holding, so that all of us will be in a environment who will be means of an entrepreneurial mindset, entrepreneurial vision, entrepreneurial mission, so that everybody will be setting up our own ecosystems. Okay, so I am proud that to announce that the Ayurpreneur word I started using it about means in the almost the September 2022. Okay, so Ayurveda and the entrepreneurship. The entrepreneurship using Ayurveda, that is what I quoted as Ayurpreneur. And my mission is to develop an Ayurveda universe so that all our Ayurveda friends should be living an Ayurpreneur lifestyle. That's why I named this particular hub, which will be a hub of all the exclusive community for Ayurveda professionals. Okay, so what I found that why we are not making money, or why we are not leading that abundant lifestyle is I felt that there is a lack of system is there. Of course, the curriculum is very good institutions are there, very good teachers are there for us. We have learned a lot of things from our teachers, but unfortunately, there is some lacking in the system. So I felt that there a particular system is required to elevate our Ayurveda people to an entrepreneurial level. So for that, I created this Ayurpreneur Academy, the Ayurveda School of Entrepreneurship, with a system where the three levels of system I have made. That is Ayurpreneur business model. This is a flagship membership and course which will give the basics of the Ayurveda and how it can be used, made into an entrepreneurship. Second level of the what you call the system is Ayurveda business mastery, which I call it as gold membership, and third is Ayurveda business empire, which is a diamond membership. It's the ultimate one. The Ayurpreneur Success Blueprint I offered as an for membership for the Ayurpreneur Academy. Now I would like to make it clear, Ayurpreneur Academy is a big umbrella. Okay, that is a big umbrella, and in that Ayurpreneur Lifestyle Hub is exclusive. Will be a community for business collaboration and helping each other to grow together without any competition. My vision, my mission, and my dream is all Ayurveda doctors, the colleagues, and the practitioners, they should come together to create, to contribute, not to compete. So for that, Ayurveda Lifestyle Hub is there. So for Ayurveda Lifestyle Hub, that more action takers will be there, and they will be very much serious about Ayurveda, using Ayurveda to make money and set up the ecosystem. So that's why I put them in the Ayurveda Lifestyle Hub. But Ayurpreneur Academy is an entry where the umbrella where anybody can enter with an Ayurpreneur bronze membership. Okay. So I am an intrapreneur turned entrepreneur, because many of my own friends, they questioned me when I was proposing this particular the course and the membership. They said that when you have not started any entrepreneurial journey, you have not launched any course, how can you become an entrepreneur? So the age has changed, the time has changed. To become an entrepreneur, you need not to have the what you call any physical product. Even a digital product, if you are having a digital product, you can be an entrepreneur. So I have done these digital products to offer my services. So I have become an entrepreneur. So till now, I was an entrepreneur because I was teaching in the classes. I was teaching in the offline. I was teaching to the students with the only Ayurveda. Now, the how the Ayurveda can be kept in, got in, means taken into an entrepreneurship, that is, I am teaching. That's why I become an entrepreneur. So the coaching system, what I founded, as I told you, the Ayurpreneur, what you call the silver membership, the first lifetime silver membership, first silver membership is level 1, that is Ayurpreneur Business Empire, which was launched on 5th of September 2023 on the eve of Teachers' Day. Okay, and I'm lucky, I'm happy that I'm proud that my teachers, all my teachers were there, and even P. Hemant Kumar sir was there to inaugurate that. Okay, just a minute. Hope my so here the problems what I could see is many of our students, okay, they suffer with what to do next, what to do next. Okay, so for that I created, along with this Ayurpreneur business model, I am giving the course where Ayurpreneur niche clarity blueprint, where they'll find out what they're supposed to do. And there is a conventional mindset. We need to change that conventional mindset to an entrepreneurial mindset. So the Ayurpreneur mindset mastery course is there. And the Ayurveda, most of the Ayurveda concepts are not clearly understood by our students at a basic level and at the subtle level. So I am trying to put the concepts of the Ayurveda into a more easily understandable and implementable way. So that's the Ayurpreneur concept mastery blueprint. Okay. And the financial knowledge in medical college, the finance is not taught. It's not a business MBA college, isn't it? So financial knowledge, we lack the financial knowledge. So this particular the lacune I wanted to fill up gap. So I created Ayurpreneur budget blueprint, and how to set up a clinic. Okay, how to set up a clinic is usually the initial question for the beginners. So Ayurpreneur clinic setup blueprint is there, and how to increase the footfall in the setup. Okay, in your clinic or in other entrepreneurship, then that is Ayurpreneur traffic building formula is going to give you the guidance. And only selling means giving a pre-recorded course will not serve. So I want to nurture all the community members. For that, so weekly nurturing calls will be there. That is, will be recorded and they will be kept in the Ayurpreneur inner vault, what you call the course. So my professional philosophy is, what I don't know, that my students should know. It doesn't mean that what I don't know, I should not pass on to my students. If I come across something, the most of the things which are what we call very new to us, and which I have not experimented, but I have come across, and if it is going to help my students, I want to pass it on. That's why whatever I don't know, that my students should know, and what I know, that my students should practice it. So with that intention only, 7 entrepreneurial opportunities, guidance and certification I identified in my in my community. And those, if they achieve the milestones, a particular milestones which will be prescribed for them, and if they achieve that milestone as per their interest and as per their particular the capabilities, assessing their own the quotients, then the 7 opportunities are there for entrepreneurship. Okay, the integrative medical practice or integrative medical, what you call the wellness centers. Okay, they are going to be the what you call the market, or they are going to be the future of the medical or the health sector. Okay, so that's why if any our Ayurpreneur Lifestyle Hub community member, if he achieves the milestone of integrative medical practices, or the setting up, establishing an integrative medical, what you call the establishment, he will be called as the Ayurpreneur Integrative Silhote. He'll be certified as Ayurpreneur Integrative Silhote. If any of our member has established his own Ayurvedic wellness center, purely Ayurvedic practicing, then he will be certified as Ayurveda Star Vaidya. And if the people who are interested in teaching and coaching, because the world needs the coaches for everything now. So especially if the health sector, if the coaching is done with the health, okay, health niche, that is because out of the four what is trending or more popular or more demand niches are out of them, first one is the health. Second one is the what you call finance. Third one is the career, and fourth one is the relationship. So the health sector is the most lucrative area which is going to be happen. So the health coaching, okay, is going to boom and it's already booming up. So I want that our Ayurveda students, Ayurveda paternities should use all those Ayurveda concepts, okay, to create their own coaching, what you call the courses, coaching system, and help the people. And by that, they can be paid a lot. So the Ayurpreneur coach Reconer is the which will be certification for them. And Ayurpreneur startup frat, if the people are into the startups, and they will be called as Ayurpreneur startup frat. And the people who are with the technology, if they make some innovations and if they start their own entrepreneurship in our community, they'll be called as Ayurpreneur Tech Genie. And the people who are into farming, okay, so they will be called as Ayurpreneur Agri Hulk. And the people who are into research, who are interested in making the write-ups, who are interested in making the publications, they will be called as Ayurpreneur Author Agile. So that is how I identified, and I have tried to make it more implementable so that the what you call the it's a playful to learn and implement and to grow. Okay, so the bronze membership, which will give the idea about the entrepreneurship in Ayurveda, and that is called Ayurpreneur Success Blueprint, and the professional goal setting, okay, which will be helping the students to understand their own goals, what are the professional goals they can set up, and how they can take it to the next journey of their professional life. So that I have created a unique formula, that is device goal setting formula, which can be do it yourself formula. You can do it yourself, you can decide your own goal, okay, using that formula. So I am offering it at a special offer of 80% of discount, which the link I will be sharing in the chat. Okay, the other next level of the gold membership, that is Ayurpreneur Business Mastery, and the diamond membership, that is Ayurpreneur Business Empire, they will be coming soon. I will be launching them afterwards. Okay, so ultimate goal of Ayurpreneur Academy is to create the what you call the self-reliant, okay, entrepreneur of Ayurveda, from Ayurveda, who will be setting up his own ecosystem, okay, within the span of 10 years. If he can set up his own Ayurpreneur ecosystem, he should be able to earn 10 CR a month, a year as a recurring income. Okay, so that is what about the Ayurpreneur Academy and Ayurpreneur Lifestyle Hub. So there is a special offer today for Ayurpreneur Lifestyle Hub membership, which will be lifetime membership. We will be getting those all the Ayurpreneur business model course. Along with that, 7 bonus courses will be there, and weekly nurturing calls will be there. And you can check it out at www.ayurpreneurlifestylehub.com. Okay, so the links I will be sharing at the end of the session or in between the session. So that is what the intention of our Ayurpreneur Academy and Ayurpreneur Lifestyle Hub. And I request all of you to join your hands to build a community which can be supporting to each other, and which will be lifetime collaboration should be there. And this will, I think, the together we can grow, single we cannot grow. Okay, so if you want to grow, you need to be what you call growing together. So that is all about this one. Now let me call upon Hemant sir. Before that, I would like to what you call introduce him, and then we can go ahead with his particular what you call the his presentation. Okay, so just a minute, sir. Anyway, Hemant sir doesn't require any introduction. The most of people is the what you call the well-known personality in the Ayurveda, and especially in the surgical branch. But still, the many of the students are here from the fourth year BAMS of Indian Institute of Ayurveda Research, and even other from other colleges. So I would like to make a formal introduction of my Guruji, my mentor, Professor Korlapotlu Hemant Kumar sir. He born on 5th of January 1969, and now at present he is the Dean of PG Studies and Professor and Head of the Department of PG Shalya Tantra at National Institute of Ayurveda, JAM, National Institute of Ayurveda, deemed to be university, that is Madhav Vilas Palace Road, at Amer Road, Jaipur. Okay. Sir has been, means he has completed his BMS from the NTR University of Health Sciences, Andhra Pradesh in the 1992, and MS in Ayurveda Shalyatantra from IMS BHU Varanasi in the year 1997. PhD he completed from NIA Jaipur here itself in the year 2010, and he has got total teaching experience of 25 years. And he is my guru, and he's a guru of gurus. Okay, he is guru of gurus, and I learned surgery from sir, and I learned a lot of other surgical skills and as well as surgeon's qualities from this sir. And he's always an inspirational, what you call the personality. So academic achievements activities are, sir has attended a massive 461. Okay, 461 workshops, seminars, conferences, symposiums, ROTP, CME webinars as a resource person and chairperson. Sir has guided 48 PG thesis up till now, PG scholars, and 21 PhD scholars. He has guided, and 21 PhD thesis have been submitted under his guidance. And sir has almost operated more than 50,000 what you call the surgical and parasurgical cases. And he's always enthusiastic to learn the new things. Even at this age, he would like, if he finds some new technique, he always rush to learn there. So sir has got a research inclination also. So sir has made 119 research article publication, and 5 books he has published it up till now. Okay. And of course, such personality is always, it deserves the awards. And the sir has been awarded Acharya Award in the year 2017 from the Central Council of Indian Medicine, which was the earlier one, as in the place of the NCISM. Sushruta Ratna Award in 2009 from the National Sushruta Association India. Best Teacher Award in 2008. Best Doctor Award in 2006 and 2007. Bishak Award in 2010. And SDM Doctor Award in 2013 from by SDM College of Ayurveda and Hospital Hassan, which is my mother institution for post-graduation. Sir has been also awarded with Bishak 2010 and Janahit Manch Award 2016 by Kanaya Lal Mishra Smriti Ayurveda Samsthan, Jaipur. Sir was awarded in the year 2019 with the Young Sushruta Award by SSR Ayurvedic Medical College and Hospital, Inchal, Karnataka. Sir has also been honored with the Best Teacher Award by Parul University in 2021. And Sir has been also awarded with Vagbhata Bhushan Award by Central Institute of Higher Tibetan Studies, Varanasi, Uttar Pradesh in the year 2022. So with this brief introduction, now I request Sir to go ahead with his presentation. So I have made you co-host, sir. I have made you co-host. You can share your screen. And if a PPT is there, you can share, sir. If you find any difficulty, I am always there to assist you. And I request all of you to listen, be attentive, and take the notes. And if any queries are there, kindly post them in the chat box. And you can ask, even unmuting yourself at the end of the session. Okay, we'll be taking up the Q&A session at the end of the session. So meanwhile, I'll be sharing the links of my Ayurpreneur Academy and Ayurpreneur Lifestyle Hub for the bronze membership and the silver membership. You can go and you can check it out. Okay. So over to you, sir.
Yeah. Slides are sharing?
Yes, sir. They are visible.
Yes. Shall I start?
Yes, sir. Yes, sir.
Okay. Namaskar. Om Dhanvantaraya Namaha. Om Manjunadaya Namaha. First of all, I am very thankful to Dr. Vivekanand Kollali and my blessings with Ayurpreneur Academy, with progress activities, propagating of Ayurveda, and I really appreciate my student, Dr. Vivekanand Kollali. And today, the allotted topic to me is a Marma Chikitsa. Actually, this is a very important field in the practice of Ayurveda. And I welcome to topic of all the Ayurvedic practitioners, teachers, PG scholars, PhD scholars, and all Ayurvedic fraternity attending today's my talk on Marma Chikitsa. See, this is our institution, that is National Institute of Ayurveda, deemed to be university, and it is a NAC accredited institution, NABH accredited hospital with all specialties of post graduation, undergraduation, doctorate courses, certificate courses, and various other, including nursing and pharmacy, Ayurvedic nursing and pharmacy. And this institution is autonomous institution from Ministry of mm, and this orthopedic and Marma Chikitsa unit treating all fractures, dislocations, and musculoskeletal disorders with Marma Chikitsa. Endoscopic unit for diagnostic aspect, for gastroscopy, colonoscopy, sigmoidoscopy, IPD. And this is the existing operation theater with all facilities. See, this is my vision of our department, hand-to-hand surgical training. This is the vision of our department. We can train our students, teaching and training hand-to-hand, and especially whatever the teachers' knowledge they will pass to our students, and our students they will pass to their students. This is the vision of our department. See, these are the services and these are the procedures we are practicing regularly in our Shalatantra department, like major surgeries, all open surgeries, like appendectomy, gallbladder, suprapubic cystolithotomy, hernial repairs, etc. Then all orthopedic procedures, we have a Ayurvedic orthopedic surgeons. They're practicing and they're treating all fractures, dislocations, including open reduction, intramedullary nailing, etc. And plastic surgery, reconstructive surgeries, and anorectal procedures, minor surgical procedures like incision and drainage, cyst excision, etc. And especially Marma Chikitsa, we have a separate unit for treating musculoskeletal disorders. And we have a MSc course, 2 years MSc course in sports medicine and marmology in our institution. There is separate department is called Department of Sports Medicine and Marmology. Then bloodletting procedures, Agni Karma, Kshara and Kshara Karma. And recently we started 1.5 years back laparoscopic procedures, lap cholecystectomy, laser surgeries, and diagnostic tools like videorectoscope and visualoscope. We have a yoga, karmagar, yoga vidhi with mannequins. This is anesthesia training mankind. And emergency mock drills. Within short, we are going to purchase laparoscopic simulator and gastrocoronic and bronchoscopic simulator for training of hand and eye coordination for our PG scholars. And within short, we are going to start modular operation theater in National Institute of Ayurveda under the support of Ministry of Ayush. The 3 operative modular OTs. One is for general surgery, another is orthopedic, and number 3 is called anorectal. 3 modular OT will start within time. See, these are the major operative theatre statistics from 2009 to 2023. The gradually increasing our procedures Last year, than 1,743 cases we operated. See, recently in September, in Times India, they given Ayurvedic hospital conducts several surgeries, more categorized to start shortly. See, these are the some of the documents. Coming to topic. See, Marma Chikitsa, it is one of the important modality in the management of musculoskeletal disorders and other systemic diseases. Marma therapy, it is the ancient Indian practice whose focus is the manipulation of subtle energy, prana, in the body for the purpose of supporting the healing process. It is an important part of Ayurveda that helps to maintain health by cleansing blocked energy. Knowledge of Marma allows the practitioners to influence the flow of prana through both the gross and subtle bodies for the purposes of restoring health. Brahma Chikitsa is a branch of Vedic science with the potential to disease and bring relief from the pain by non-surgical methods to some disorders even without medicine. This is the very important, you can see some of the musculoskeletal disorders we can treat without any medicine. See, Marma Chikitsa, it is a non-surgical, non-medicinal intervention, reaching the poorest strata and curing all kinds of neurological, bone and other elements. See, usually what we have seen the textbooks, Susruta and other textbooks, the Marma should be avoided during surgery. We have seen so many places, Marma points to avoid, or you can go for by careful in the Marma points surgery. For example, if you go for a hydrocele surgery, especially in the median raphe, you must to avoid median raphe incision. Like that, some of the places like Buddha Marma, especially in the sphincter places, surgical procedures, you must to give concentration of avoid marmas, or you can give cautious surgery in marma places. See, marmas are made use of in manipulating management of injuries like martial arts, fights, etc. in manipulation to treat on the spot during martial arts. If you go for history, in Dhanurveda, especially the science of archery, that is the Upaveda of Ayurveda derived from Vishwamitra, is the prime source of Marma Vignan. The details available in Ayurvedic Samhitas, vernacular books, and local health traditions, Kalari schools, etc. It is still practiced by local Vaidyas as well as qualified surgeons or physicians in India and abroad. See, you can go for in Ayurvedic classics. They mentioned about Marma Sarira in Susu Samhita, Ashtanga Hrudaya, Ashtanga Shangraha, Charaka Samhita. And also they given the Marma Chikitsa or Marma Abhigata Chikitsa mentioned in Susruta Samhita and Varma Kalai. See, in Tamil language, the Marma named as Varma. See, like in Kalaripattu martial arts, they named as Kulyana Marmas or Abhyasa Marmas. See, coming to Marma, Marma is the origin from Murun, Mareni, or Muryate, Ashwini, Iti Marma. That means the specific parts of the body which are very vulnerable to trauma, known as Marma. Any trauma, these places may lead to death or may lead to complications. See, Marma is a site of where two or more types of tissues meet. That's why Mamsa, Sira, Snayu, Sandhi. These meeting places, usually you can see the Marma points. Already we discussed that Marmas are the seats of pranic current, that is Jiva Dharani. It is a site of Vata, Pitta and Kapha, Rajas, Tamas and Sattva and Bodhatma. See, Marma is one among Varana Vastus, prognostically the most difficult and very important during surgical intervention or parasurgical intervention. You must take care about Marmasthanas. See, according to various textbooks and our classics, Ayurvedic text is mentioned 107 by 43 names. And Tamil text, they mentioned 108 Varmas. That is Marma, the Sanskrit word they consider as a Tamil is a Varma. In Kalari text, they mentioned about 64. But in Tamil literature, they identified more than 8,000 Varma points, that is Marma points. And small, whatever Marmasa 107, they give in detail description in the Tamil literature of Varma. See, Marma therapy is based on the utilization of 107 points in the body, which are considered to points to the body, mind, and consciousness. So you can go for that. Marmas is corresponding to 7 chakras. And these points cover both the front and back of the body, including various marmas number, like 22 in lower extremities, 22 on the arms, 12 on the chest and stomach, 14 on the back, 37 on the head and neck. See, these are the various 107 marmas covered in the body. Then what is the importance? Number one, it is a non-invasive, non-surgical, can be done without any medicine, can be used with conjugation in any other medical field, and cost effective, no adverse effect or side effect if we go for proper administration, proper manipulation of marma. See, before administrating marma treatment, you can go for the fundamental rules like you must think about the body of the patient as our own, as his life as our own life. Number one. Number two, fingernails should be properly cut in both the hands. Why? Because during marma manipulation, they may injure to the skin and other parts. And marma points should not be touched with nails. And during marma manipulation, keep silent and concentrate during performing Marma Chikitsa. That is very important. The patient sit or lie down during marma therapy, depend upon the position. For example, if it is sciatica, we can see lie down position. If it is a frozen shoulder, cervical spondylosis, we can go for sitting position. And usually what happens, it is better to remove cloths during marma therapy, but can be done with the cloths on hand. Why? Because, and usually in Tamil literature, they mentioned about female patients for female consultants and male patients for male. But nowadays, what happened? We can go for with the clots, especially in the female patients, we can go for with the clots. Also, we can go for manipulating techniques. We can manipulate and we can get you the same results of Marma Chikitsa. See, usually we have a protocol developed in our institution. Usually we can go for marma therapy twice a week, or sometimes the severity of the disease, it can be done daily or even 6 hourly as well, depend upon the acute muscular or musculoskeletal pain. In a very emergent cases can be done with the interval of 20 minutes also. That means frequently we can go for Marma Chikitsa. See, these are some of the clinical indications practicing Marma Chikitsa in headache, migraine, cervical spondylosis, frozen shoulder, tennis elbow, low backache, sciatica, stress or psychosomatic disorders, anxiety, depression, insomnia, osteoarthritis, rheumatoid arthritis, hypertension, diabetes mellitus, and other lifestyle disorders. We can practice Marma Chikitsa as maybe alone or maybe along with medications and also with Panchakarma treatment. See, some of the contraindications mentioned in the classics like snake bite, scorpion bite, poison consumption, sleeping position, hyperpyrexia. In that condition, better to avoid Marma Chikitsa or you can go for carefully. See, today, why? Because Marma Chikitsa it's a very used talk and today I am concentration about apabahuka or frozen shoulder. Why? Because some of the diseases is scientifically taken as a research work as a PG or PhD in our institution, and we developed some of the protocols to practice disorders. And today I am going to discuss about the frozen shoulder. See, apabahuka is really affects amsa sandhi, bahu, and it leads to pain and restricted movements. That means it is the dysfunction of the arm, stiffness in the arm, or disability of the shoulder joint. That's why amsa kurparantaram pratyagamakam. It is a freezed or frozen shoulder. These are the dosha dushyas involved in frozen shoulder, like vata involvement, especially vyana and pranavata, kapha anubandha dosha, mamsa asti dhatus are involved, and upadatus like sira, snayu, kandaras are involved, and astivaha, majjavaha srotas are involved, and it is usually the sangha is the srotodushti, and Dhatwagni and Jataragni is involved here. And these are the Udbhavasthana, Sancharasthana, Adhishtanas, and Roga Marga is Madhyama Marga. These are the Samprapti Gatakas. See, coming to frozen shoulder is nothing as a adhesive capsulitis or periarthritis. See, the connective tissue surrounding the glenohumeral joint of the shoulder becomes inflamed and stiff and restriction movements and causing chronic pain. That's why there is a significant loss of active range of motion, AROM, and passive range of motion, that is PROM. See, this is the pathophysiology. Actually, we have seen in the normal practice, diabetic patients are more prone for frozen shoulder. See, Marma science is an instant, natural, and non-invasive way of healing, as it is art of treating certain vital points to rechannelize the prana. See, this is the protocol we developed in our institution. Number one, we start Marma manipulations in Marma points, especially for frozen shoulder, is Kakshadhara, Apastamba, Amsa, Ani Marma, Shipra Marma, Manibandha Marma. These six Marma points we are going to manipulate and to relieve the frozen shoulder within 5 minutes. See, another very important application of matra pressure is there. This is very important, like 1 matra pressure and half matra pressure and 3/4 matra pressure. See, usually we can see depend upon the mamsa, sira, snayu, asti, sandhi. You can go for 1 matra pressure and half matra pressure, 3/4 matra pressure. See how to apply. Each marma is stimulated 10 to 15 times in the same rhythm of inhale and exhale. So you can observe the patient by inhaling and exhaling, and automatically we can digital pressure in one sitting. You can go for 10 to 15 times, press and release at the marma points. The rhythm of stimulation is same as the rhythm of respiration. See, first stimulation is Kakshadhara Marma. I think everybody knows Kakshadhara Marma is a Snayu Marma and Vaikalakar Marma. If you go for exact site of or location of Kakshadhara Marma is between the Vanksha and Kaksha, that is chest wall and the armpit or axilla. See what is the position, how we can manipulate it, how we can press and release it. Place the pulp of the middle three fingers. See, middle three fingers and thumb should be placed at the back of the support. Then you can use here 1/2 half matra pressure, press and release 15 to 20 times. And coming to, these are the structures, anatomical structures of Kakshadhara Marma, like brachial plexus involved, pectoralis minor muscle, median nerve, ulnar nerve. These are involved in Kakshadhara Marma. The number 2 is Apastamba Marma. There is a second Marma is Apastamba Marma. It is a Sira Marma and Kalantar Pranahara Marma. It lies 4 fingers below suprasternal notch. See, it is the over mandibular along the straight line of the body. You can go for 4 fingers below the suprasternal notch. You can place the hypothenar. You have seen the picture. This, my hand is in hypothenar part of the palm, horizontal and the marma point. Using half matra pressure and release 16 to 18 times according to inspiration and expiration of the patient. This is the second manipulation marma, is called Apastamba Marma. There is another Apastamba Marmas. These are different structures involved here: trachea, bronchus, phrenic nerve, vagus nerve, etc. Then coming to third marma manipulation is Amsa Marma. See, it is a Snayu Marma and Vaikalaka Marma. You see the exact location, you can see it is upper back, one on either side of the vertebral column, at the junction of the shoulder and neck. You see that the thumb should be placed on the marma point. You see, my thumb is present at the marma point. Both the sides of Hamsa Marma, I am going to manipulating, press and release, and using half matra pressure 16 to 18 times simultaneously. See, one is Kakshadhara, number 2 Apastamba, number 3 is Hamsa Marma. See, these are the structures falling in the areas of Hamsa Marma, like coracoclavicular ligaments, coronoid ligaments, trapezoid ligaments, etc. See, then another Marma, Ani Marma. It is a Sira Marma and Vaikalakara Marma. It lies 3 angulis above the corpora, that is above the elbow joint. The 3 angulas, we can place it, especially place the first interphalangeal joint of the thumb or marma point. Other fingers placed in outer side of the arm of the support. You can see my hand, thumb is at the present of the above the 3 angulas above the corpora sandhi, that is elbow joint, and remaining 4 fingers outside of the arm. Here we are using 1/4 matra pressure, press and release for 16 to 18 times. This is a Ani Marma. These are the structures falling in the areas of Ani Marma, like biceps, brachii muscle, brachial artery, median nerve, ulnar nerve, etc. Then another is called Manibandha Marma. See, Manibandha Marma, it is a Sandhi Marma and Rujakara Marma. It lies at the wrist joint. Place the first interphalangeal joint of the thumb on the Marma point. Use 1/4 matra pressure, press and release for 16 to 18 times. This is called as a Manibandha Marma. Ani Marma, after that Manibandha Marma, and lights at the wrist joint and place the first interphalangeal joint of the thumb on the Marma point. Press and release by 1/4 matra pressure. Then last Marma manipulation is Kshipra Marma. It is a Snayu Marma and Kalantara Pranahara Marma. Lies in the first web space at the junction of the thumb and index finger. Place the pulp part of middle three fingers along the thumb, or we can use the directly thumb also. We can use for the pulp of the thumb also. We can use for press and release 16 to 18 times. See, these are the Kshipra Marmas structures falling like intermetacarpal space, dorsal interosseous muscle, adductor pollicis, flexor pollicis, etc. See, then what is the outcome of Marma therapy? This is very important. We will assess and what is the outcome. See, any research work, they must to go for some protocol and the manipulating techniques. You can go for assessment criteria like pain and stiffness as a subjective criteria, and objective criteria is a tenderness and different movements during improvement like abduction, adduction, flexion, extension, and circumduction, etc. See, this is the assessment scale of tenderness, stiffness by gradings from 0 to 4. And assessment of tenderness, we are using pressure algometer. Before treatment and after treatment, how much pressure it is reduced to assess the tenderness with algometer. And range of motion of shoulder joint, you can assess with goniometer. We can go for the all the movements, abduction, adduction, rotation, flexion, extension, etc. See, these are the abduction, adduction, flexion, extension, circumduction criteria of gradings from 0 to 4. See, some of the clinical cases we can see, we'll discuss here clinical cases like before and after treatment. We can see the history of 1 month history of this patient complaint of very difficult to raise the right shoulder. We can see that before treatment, what is the position of the right shoulder, and after treatment, what is the position of the shoulder, and history of diabetes and 1 month history of frozen shoulder. See, not only for manipulation, we will give sometimes internal medications according to the condition. If it is a diabetic, you can must to control the diabetes. And after manipulation of Marma Chikitsa, then you can go for some exercises also. Proper physiotherapy also very needed. And you can go for shoulder exercises very needed. And you can advise during therapy. See, this is another interesting case. Actually, long-standing case of frozen shoulder. You can see the left shoulder and history of 2 years history is there, and very difficult to raise the hand. And almost I treated this patient around 1 month. You can see the follow-up of this patient. You can see continuously follow-upping. We can see this patient how almost it takes more than 1 month. This is also another case of left frozen shoulder, history of diabetes, and this is the before and after treatment. How you can see within 5 minutes raise the hand. You can see the patient dress also. Some patients need some time. And first sitting, we can raise the shoulder, and following with proper shoulder exercises are very essential and needed. This is also another case of frozen shoulder before and after treatment. This is, you can see the left shoulder joint frozen and before and after treatment. See, this is another old lady complaint of frozen shoulder. But single sitting, it is raised, and we can more than 2 weeks we treated this patient with Marma Chikitsa along with the shoulder exercises. See, this is also another case of frozen shoulder and before and after treatment of right frozen shoulder. This you see the another patient of left frozen shoulder before and after treatment. See, this is another case of right shoulder before and after treatment of frozen shoulder. You can see this is another case in the male patient. You can see right shoulder, history of diabetes. See, this is another case. It's a pediatrician, modern pediatrician, suffering with 1 month, suffering with 1 month of frozen shoulder and not interested for manipulation under general anesthesia and single sitting. It raised left frozen shoulder. See, this is another case of frozen shoulder. See, this is also, you can see right frozen shoulder before and after treatment. This is also another case of frozen shoulder, right side. So this is also left frozen shoulder. You can see history of diabetes, long-standing case. This is another case of before and after treatment of frozen shoulder. See, this is I given, see the face of the patient and before and after treatment. You see the how the face before and after, laughing face after treating with Marma Chikitsa. See, some of the research works we conducted in our department in NIA, like a comparative study of Marma Chikitsa and Agni Karma in the Avahoka, and Marma Chikitsa and Agni Karma in the management of Kurtrasi, sciatica, and Marma Chikitsa, Agni Karma, and along with the Trayagada Sangha good with Rasna Saptakwada in the management of Snayu Vikara, especially tennis elbow. There is a comparative study with Agni Karma, Marma Chikitsa, and therapeutic ultrasound in the management of Avahoka in periarthritis shoulder or frozen shoulder. We taken the comparative with the therapeutic ultrasound also. And you see how, what is the probable mode of mechanism of action of Marma Chikitsa? It is a manipulating the Marma points, changes the body biochemistry, and can unfold radical chemical change in body makeup. It is stimulation of the inner neurological pathways, signals to the body to produce certain neurochemicals that heals the body and mind. See, this is the message and concluding of the frozen shoulder. Marma Chikitsa release the acute pain, spasm, and reduce the frequent attacks of pain. This is very important. Non-invasive, cost-effective, less expensive treatment, and it is a high time to undertake such work. See, we can't say final conclude about the how it is acting in all aspects. Definitely, and we started this work last 7 to 8 years in our institution, and till we are continuing the same research works, and definitely we will prove the uh, scientifically and evaluate the Marma Chikitsa in the especially musculoskeletal disorders. Another thing, as I observed, the patients of musculoskeletal disorders, you can give this treatment in OPD itself to create the confidence of the patient, and following you can go for Ayurvedic line of management and medications, panchakarma and physiotherapy. Definitely we can achieve or create the confidence the patient during treatment. That's why Susata mentioned Astameva Pradhana Yantra. Thank you. And we'll go for any queries, any suggestions, you can ask.
Thank you, sir. Thank you for the wonderful presentation. And definitely, I feel that the results what you have shown at no cost and very easy to implement and practice. I feel that the participants who are here, they might have got that encouragement, and definitely they'll come up with a lot of queries. And one interesting thing I would like to share, sir, here. Let me share my screen. Okay. One engineer is here, there in Noida. Okay, Greater Noida. So he is actually is an engineer with mechanical degree.
Okay.
And he is actually his wife. Okay, his wife suffered with what you call the maybe as per his whatever the claim is that she was suffering with the spine problem, and because of that she was not able to move. She was bedridden for 12 years, and this fellow was an engineer, and then he took her to Haridwar. Okay, maybe to the Sunil Kumar sir, I don't know.
Yes.
And there he got the bedridden lady started walking after this certain period of amount of the Marma Chikitsa. And because of that, he got motivation, and then he has now learnt anatomy in diploma in anatomy from Lucknow, then learnt Marma Chikitsa from Haridwar, and acupuncture and acupressure. Now he is calling himself as a spine engineer rather than the what you call the automobile engineer. Okay, mechanical or automobile engineer. So he is from, and he is running his clinic in the Noida, Greater Noida, and he takes online workshop also. Okay, and by that he is earning lot of amount of money, and our Ayurveda people, okay, especially the Rachana people, they can think about this, because as you have established, you have convinced, and you have given the what you call the evidences that this is really effective. And I feel that it is high time to what you call wake up and use all the age old and scientific methods of our own science at at OPD level, and it doesn't require any cost, any investment also. So I think this should be looked into a very serious way. Okay, so now I feel that the Rachana people, at least the Rachana people and surgical people, our own surgical people, can also take as one of the specialty. Especially they can be, brand themselves as an expert of Marma Chikitsa, and they can help in the sports medicine. Okay. Meanwhile, sir, I will take up one question. There is a question from Virendra Minhas, Dr. Virendra Minhas, whether this Marma Chikitsa is useful for cervical dystonia.
It's very good question actually. See, everybody knows about cervical dystonia is nothing as a spasmodic torticollis.
Yes, sir.
Why? Because it is a painful condition in which neck muscles contract involuntarily and
Yes, sir.
causing patient head to twist or turn to one side. Actually, really, it is a no permanent cure for this, but we can relieve the patient pain. We relieve the patient spasm
Yes, sir.
for reducing of the recurrent attacks of pain, we can reduce with Marma Chikitsa. I can go for what we have seen that Amsa Marma, and especially for Kakshadara Marma, Amsa Marma. And there is another one Marma point, it is not mentioned in our Ayurvedic classes. There is a Mudichi Varmam. It is mentioned in Tamil literature.
Yes, sir.
That also we can practice what the treatment of cervical spondylosis. We can
Yes, sir.
reduce the spasm and pain of the torticollis. But it is there is no complete cure for the cervical dystonia. But you can avoid the recurrence.
Thank you, sir. And there is another query from Dr. Nandini Maitre. So whether how to get a hands-on experience for BMS doctors who have no previous exposure to Marma Chikitsa?
When it is a correct, actually, we conducted some of the workshops actually, and we have a course and some courses. That time there is a offline hands-on training programs are there actually. Why? Because the online programs we can't see. Depend directly we can see in the offline. That is, we are conducting some of the programs in our institution, and it is available in a website also. And I think in 2019 we conducted a workshop also, Marma Chikitsa workshop. And now it is going on some of the courses in our institution. And already I mentioned MSc course for 2 years. And BAMS graduates and MBBS graduates or any other system of medicines can join this course. See, that is more appropriate. Why? Because 1 day, 2 day, 3 days, Marma Chikitsa, it is not possible at all. You can go for continuous observation, continuous seeing of the patients, then you have a knowledge about Marma Chikitsa.
Thank you, sir. There another query from DG Jitya. That is so whether any headache related to headache, how any management with a particular any Marma?
Definitely, definitely. And see, headache and migraine, and we can reduce immediately to reduce the pain. Why? Because migraine is a recurrent attacks. We can see that. In that, we can go for Stapani Marma.
Okay, sir.
Stapani Marma, Apanga Marma, and Pana Marma, and Shanka Marma. Simanta. There are 5, 6 marmas are there. Stapani, Apanga, Pana, Avarta, Simanta. Okay, these are the marmas. We can manipulate it. Definitely, we can reduce the headache. And especially these marmas, we can reduce the pain, acute pain during attack of uh, headache and migraine.
Any special precaution need to be taken for Shankamarma when you are dealing with Shankamarma?
That's why I'm telling, already I mentioned about Mamsa, Sira, Snayu, Asti Sandhis. There is a matra pressure I mentioned. Half matra pressure and 1 matra pressure and 3/4 matra pressure. According to Sandhi, we can go by 1/4. Okay. According to Mamsa Marma, you can go for 1 marma. Like that, you can go for depend upon the Mamsa Sira Sandhi Ayu. That you can go for manipulations.
Can you suggest any good books, sir, on the Marma Chikitsa? Any resource
Yeah,
for
Marma Chikitsas, I think it is available in the market by Sunil Kumar Joshi. There is a Marma book is there. And from CCRS also one Marma is. And within short, we are going to publish Marma Chikitsa from NIA also.
Okay,
And it is available in the market. You can search in the Google. It is available. CCRS book is available. That is very good book.
whether you are conducting any short-term courses, sir, the two MSc, I think
At
they will be
present,
very
we
long.
not started any short-term courses. Actually, plan is there, but not decided till. And now at present, 2 years course is there.
Yes, sir. Sir, in Apabahuka, you mentioned that Agni Karma and Marma Chikitsa you did and then comparative study. What was the
Mhm.
outcome, means your finding, observation?
Mhm. Mhm. Then actually, what happened? See, I am getting some patients. Both results are similar. But what happened? And maximum patients they are not interested for Agnikar.
Yes, sir.
You see, that is one point. Another thing, and acceptance also very important. You see, by Agni Karma, maximum patients they will reject it. One. And pain actually, what happens, some of the conditions, the spasm will reduce with Marma Chikitsa, then Agni Karma. Pain relieving both Agni Karma and Marma Chikitsa is a similar effect is there. But spasm will reduce with Marma Chikitsa. And also what happen, another very important Marma Chikitsa, we can encourage the patient for self Marma Chikitsa treatment. You can advise the patient, we can go for like this and you can go for like this and Sapani Marma, you can go for all the Marmas, we can train the patients during attacks. But we can't train Agni Karma by patient.
Yes, sir. That is
So that is another beauty of Agni Karma.
usability is good for Marma.
Yes, yes,
Marma chicken.
yes. Acceptability also is good.
That is what we are seeing that I told, no, sir, engineer. He
Yes.
advises, he guides on the online coaching he does to do do yourself for the patients.
Mhm.
So many of
Mhm.
these one. So by that he is really popular and he is making use of that. And sir, regarding what is the difference? Whether there really difference is there or the same principle is used in chiropractic?
Which
Chiropractic or chiropractic, they tell, no, sir.
actually there are some differences are there actually. Acupressure and Marma Chikitsa manipulation by the our peoples. But points also there are different points are there.
Yes, sir.
And especially we can see that they will go for specific points in acupressure. But stimulation techniques are different. Especially Marma Chikitsa stimulations are different. And in acupressure, they will go for more deep pressure on the points, Marma points. They will
Yes,
give
sir.
more pressure uh, to reduce the pain. But we are giving according to Mamsa, Marma, Sandhi, Asti. Like that, we will go for matra pressure and manipulations. Some will they never go for stimulation. They will go for simply deep pressure and release. Another important and some practitioners they're using Marma points with they're using some oils that is called Marma massage or Marma Abhyanga. That is also relieve the patients. Or some practitioners they're using Marma bandages. Why? Because sometimes injuries, trauma, sprains, they will go for Marma Abhyanga followed by the splints and bandages.
Yes, sir. Sir, any you have got any experiences with the dysmenorrhea, whether Marma can be used for dysmenorrhea? Any certain points are there?
Actually, there is no what is called experience, but definitely we can go for in psychosomatic disorders. We can go for especially Shankamarma, Stapanimarma, Panamarma. We can relieve the what is called stress. Why? Because dysmenorrhea we can go for, but there is no idea for dysmenorrhea with Marma Chikitsa.
Okay, sir. Sir, whether cervical spondylosis
Yes,
is
yes.
completely curable with Marma therapy or it will be recurring?
Yes, yes. One thing, cervical spondylosis is a very big thing. You must to see the degenerative changes are not according to the bone condition, then you can decide it. Why? Because only Marma Chikitsa we can't treat. Medical treatment also sometimes not possible. Or sometimes what happen, you see, this Marma Chikitsa is adjuvant for go for a Nasakarma, Panchakarma management. Definitely it will respond.
Yes, sir. Sir, and what are the Marma points for sciatica?
Actually, sciatica usually what we are practicing in sciatica, what they mentioned, especially Kshipra Marma, Gulfa Marma, and we start from Pada Kshipra Marma, followed by Tala Hrudaya Marma, Gulfa Marma, Indravasti Marma, Janu Marma, Ani Marma, Purvi Marma.
Yes, sir.
And these points, it is according to classics, we can there. We can manipulate Chipra Marma to Uri Marma. and where the maximum tenderness point also you must have to identify that. And maximum what I observed, the response with Gulfa Marma manipulation is excellent results in sciatica.
Yes, sir. Thank you, sir. Sir,
Mm.
is there any
Mm.
particular reason, specific reason why you are means with the particular with the 15 or 18, 15 to 18 times of pressure, means that rhythmic pressure,
Yeah,
whatever?
actually, what happened? You see, actually, I trained both Marma Chikitsa by the Sunil Kumar Joshi sir and Varma Chikitsa from Coimbatore from Shanmugam sir.
Yes,
See,
sir.
in Varmology, they mention only 3 to 5 times. In Tamil Marma, they mentioned only um, 3 to 5 times they mention. And 3 to 5 times they mentioned actually. But actually, according to Sunil Kumar Joshi sir, why? Because during inspiration and expiration, we can go for manipulations that is more appropriate according to Joshi sir.
Okay. So the number can vary.
Yes, definitely. Why? Because I am practicing both Varma and Marma.
Yes, sir.
Varma and
Okay.
Marma I am practicing. That's why what happened, I trained first Varmology, and
Hmm.
3 to 5 times is not sufficient for the patient.
Okay, okay, okay. Yeah.
Uh,
So it is your personal observation also that
yes,
the
yes, correct.
more number of this one
Yes,
means
yes.
sittings
The
means
first
the
thesis,
pressures.
my first thesis, I started 3 to 5 times.
Okay, okay, okay. Yes,
Then
sir. Yes, sir.
second further thesis, I started 16 to 18 times. That is more appropriate. This 3 to 5.
Any complications you could find out, sir, because of the wrong technique?
Actually, what that's the wrong procedure. Definitely increases the pain. What I have seen that pain increases if not
Yes, sir.
properly manipulated. Pain must have to increase. That is the only remaining some complications they mentioned. Some practices, some neuralgia,
Hmm.
policy, etc. But I have not seen that type of complications during my manipulation of Marma Chikitsa.
Another question is, sir, whether this acupressure is different from Marma Chikitsa or both principles are same?
Yeah, almost somewhat similar, but there is different sites are different. Manipulation technique is different.
Okay, sir. Another question, of course, I feel that it is a vague question, but still I
Mhm.
would like to read it out.
Mhm.
Sarika from Sarika, Dr. Sarika, is
Mhm.
any Marma point management for back pain? So back pain means upper back pain, middle or lower back. Both you can share, sir, your opinion.
I mean, actually, what happened? You can manipulate Katikatarani Marma and Kukundar Marma.
Okay.
If it is radiation pain is there, then you can go for Ani Marma, Indravasti Marma, or Chipra Marma, or maybe Gulfa Marma. If it is radiation, sciatica,
Hmm.
only if it is present at the lumbar spondylitis or sacroiliac joint pains, that you can go for Katikatarani Marma and Kukundar Marma. We can go for uh, manipulations up to Urhati
Yes.
Marma also.
Okay. Okay. So again, it depends upon the either it is radiating or it is localized
Yes,
pain.
yes, correct, correct, correct.
Yes, sir. Yes, sir. Sir, what you? I think this question is already answered. The cervical spondylosis, you mentioned the names of the marma, points of the marma, isn't it, sir?
Same Marmas what you are seeing in the frozen shoulder. We
Okay.
can go for that. Again, cervical spondylosis is radiation brachyalgia, that is brachial neuralgia is there or not? Radiation pain
Hmm.
is there not? That is depend upon that. If it is only that pain, Amsa Marma, and especially for Mudichvarma, I have shown that, and cervical SC7, C8, we can go for manipulation. And another is called Kakshadhara Marma. We can go for that. If it is radiation is there, then you can go for Chipra Marma, Ani Marma, Manibandha Marma, then you can go for like that.
There is an interesting question. Sir, if a
Mm.
complication are there, and if the
Mm.
excessive wrong manipulation is there, then how ethical or how means safe it is to ask the patient to do on themselves? This is from Kamiani Maurya.
Ante what complications?
If means if we expect the complications by extra
Mm.
pressure or wrong technique, if their complications can occur, then how safe it is to ask the patient to do themselves on their own.
Yes. See what happens, self Marma Chikitsas, you must to train to the patient. See, we can 1 week you can go for the proper training to the patient. Only don't go for what is called Sira Marmas and Snai Marmas. You can must do carefully. You can give some of the Marmas. For example, if you go for Ani Marma, you can hold your like this and you can press like this, like this.
Yes, sir.
See, this is just like this. Like that, you can go for it. You can see Amsa Marma, you can go for like this.
Yes,
Like
sir.
this. Okay. That you must to train properly. Not for all the
Yes.
conditions.
So first
Not
they
for
should
all
be
the
trained,
conditions.
then only they can be allowed
Not
to
for
do
all the
on.
conditions. All the
Yes, sir.
conditions are not possible. I am giving the some of the example of what is called cervical spondylosis, migraine, headache. Simple things we can go for self. Another thing, what happened, how we are practicing regularly by yoga, pranayama, asana. Like that also, our individuals also we can stimulate our own marmas.
Yes, yes. Sir, whether children indication is in the children is there for Marma Chikitsa? That's the
Yes, we
question
can go
from
for children's
Rajeshwari.
also.
You can go. Means
Yes.
what up to miss what age? Any age specification is there? Any
There is
contraindication is
no
there for the
age
any age?
specification. There is no age specification according to the condition. They will go for manipulation. The pressure is important.
Okay,
How matra pressure? How they mention? You can reduce the matra pressure.
okay. There is another query from Kirthana Raji.
Hmm.
Whether you have come across any actually stand down cases where you have done the Marma Chikitsa?
Then Achilles tendons better go for Gulfa Marma.
Okay.
Gulfa Marma and what is called Indravasti Marma.
Yes, sir. Yes, sir. Yes, sir. Okay. Still, if any more questions are there, kindly post in the. Yes, there is another question from Kamiani. That is, what is the concept of pain relief by Marma? That already sir has
See,
explained.
this is very important thing. Still, we are under research.
Yes,
How
sir.
till we are Ayurvedic peoples, we are getting a wonderful results after Agni Karma. Is it
Yes,
correct?
sir.
But
Yes, sir.
till we are not analyzing that what is the real background of relieving of the mechanism of action. All the things are what happens. See, sometimes we can't say that by patient relief and patient is also one of the scientific background. We can't say that I prove all the things to prove it for scientific brand. Nowadays, what happened? The patient documentation also they consider as a scientific proof that to relieving of the pain. Okay,
Yes, sir.
if the pain relieving also, then patient is coming again and again. But we
Okay.
can't say that exact concept, exact mechanism. It is very difficult for Marma Chikitsa and also for Agnikar. So till is we can go for one by one. Why? Because see, this is very important. We are a practitioners. We are getting the results and associating with the physiological, pathological persons. We must to go for. Already, I suggested one topic for physiological aspects of some Marma points during manipulation. How it physiological changes are going on. That type of studies we can go for that. We can get a better conclusion.
Yes, sir. Thank you, sir. Thank you. Meanwhile, I would like to show my website, sir. I want to have your look
Yes.
also. Uh,
Hmm.
this is what the website, Ayurpreneur Lifestyle Hub. So the whole description is there, what exactly we want to do, in what way we are going to help. So it is mainly to start up and set up and scale up. And the benefits for the community people will be education, then streamlined success will be there, monetization concepts will be there, then relevant space for the need of the hour and sales and services. And of course, the I tried to put all my knowledge, sir, whatever the training I underwent in the last 3 years. That is, with especially other than the our formal training, I took training for the what you call the numerology. I took underwent the training for neurolinguistic programming, and then digital marketing, then the book writing, book publishing, all those things. So I want to put all those things. I want to give all those things to our Ayurpreneur Lifestyle Hub members, so that they can have different what you call the multiple source of income. So I try to put all my concepts, what I understood, the skill, what I'm having, niche clarity, then building their mindset, because I underwent the mindset trainings also, and leadership and communication, what you call trainings also, and business, what you call trainings, okay, and the what you call the goal setting, how the goal setting should be done, and the Ayurveda Chikitsa and Sattva Chikitsa I'm practicing in my day-to-day practice also, and of course, numerology and medical legal aspects also, because I am basically law, I have completed law, and luckily I have got a lot of the teachers who can enlighten us with the medical legal aspects also. So with that, the memberships are there, sir. I have made 4 levels of membership. The VIP bronze membership is with the 2 courses, as I told earlier. A monthly one my mastermind session I'm offering them, like as it is going on today. Okay, and lifetime access. That is the website prices are at 4,999, but I am offering it at only 999. Okay, for at a discount. And this Ayurpreneur Silver membership, which is the entry for the Ayurpreneur Lifestyle Hub, that is at the website price is, even though it is 15,000, and the total value it goes to 89,000 along with the bonus courses, but I am offering it at only 5,000 rupees at the once they go to the what you call the if they click here, they go to a landing page, and in that landing page they will have a action button here again, where they can apply the coupon code and they can have it 5,000 rupees. So it is an effort, sir, from my side. I would like to motivate the students, and I would like to give some vision and guidance, so that they can have multiple source of income, and they can be competent in any area. So that is, I request all of you to at least visit my website once, and even you can give share your feedbacks also, so that uh, so that I can improvise and I can help more. And of course, my teachers are there, their blessings are there. And today, sir, you have really blessed my community and my students, especially my own students are there from the Indian Institute of Ayurveda Research, and even other students are there. I thank all those students who have joined, all the doctors who have joined for this wonderful session. And of course, on the behalf of the all the participants, sir, as well as my wife, the co-founder of the Ayurpreneur Academy, and myself, I thank you wholeheartedly for enlightening us with your all the Marma knowledge, sir, and hope in future also you'll be blessing us with all your knowledge. And you are the true inspiration for all of us. And with this session, I think that at least the people who are 70 plus people who are there, and out of them at least 10%, if they start practicing what you call Marma Chikitsa at their level, at least for the few conditions, that thing it will be worth of learning. Okay, sir. Thank you, sir, for being with us, and uh, hope to continue in future. And any feedback from your side, sir, to improvise the our platform and all things, you can.
Thank you, Dr. Vivek, and my blessings always with you. And all the best. God
Yes,
bless
yes.
you. Go ahead.
Thank you, sir. Thank you. Thank you. And even all the
Good day.
participants are telling that it's a wonderful session, sir, and they are thanking you for this informative lecture. They all of them are thanking you, sir. Okay.
Thank you. Bye.
Thank you, sir. Thank you. Thank you, sir.
Okay.